What does an X-Men superhero and a tiny 15 amino acid peptide have in common? Well, that's how BPC 157 got the nickname, the Wolverine Peptide. Athletes and biohackers noticed that stacking BPC 157 and another peptide called TB500 led to surprisingly fast recovery, and so the Wolverine stack was born. Now, while you won't leap over buildings or regenerate overnight, I've seen patients report faster healing, better recovery, and resolution of gut symptoms, and reversal of autoimmune disease. Hi, I'm Dr. Rajka, your functional medicine MD, board certified in family and integrative medicine and certified in functional medicine. Today, we're talking about BPC 157, what it is, how it works, and how it might help you heal smarter. So let's dive in. What is BPC 157? BPC 157 stands for Body Protection Compound 157. It's a very short peptide, just 15 amino acid chains derived from a protective protein found in a gastric juice, yes, from your own stomach. Researchers in Croatia were studying why our stomach lining doesn't self-destruct under all that acid. And what they discovered was this peptide, BPC 157, not only protected the stomach, but help accelerate healing across multiple tissues. BPC 157 works through 5 mechanisms. It boosts blood flow to injured areas, stimulates collagen production, supports the gut lining, regulates neurotransmitter production, think dopamine and serotonin, and protects cells against the healing process. It's like your body's internal contractor managing the repair project instead of just putting up that caution tape. Let's look at what the science says. Animal studies show BPC 157 may protect the brain after trauma, stroke, and even toxin exposure. It reduces neuroinflammation, stabilizes mood-related neurotransmitters, and may promote nerve regeneration. Secondly, it supports musculoskeletal healing. In animal studies, BPC 157 sped up tendon recovery after injury. Muscle injuries heal faster with less inflammation and better structure. And early studies suggest it may also support bone healing, though it's still being explored. And then there's the gut support. BPC 157 helps support against non-steroidal anti-inflammatory damage. It accelerates ulcer healing. It's been shown to be supportive in Crohn's and ulcerative colitis. Now, most of these studies have been done in animals, but they are promising, and I'll show you the implications and results my patients have reported. So how do I use BPC 157 in my clinical practice? I use it for gut issues like intestinal permeability, refractory reflux, people who are dependent on PPIs, for injury recovery or post-operative recovery, for brain health, supporting recovery from concussion, recovering brain fog, or even inflammation-driven mood issues. It's rarely used as a standalone item. It's almost part of a bigger healing protocol, which is customized to each patient. Now, how do you dose BPC 157? There are 2 ways. You can dose it orally or injectably. Orally, typically I'll use 500 micrograms twice a day. Injectably, you can use 250 to even up to 1,000 micrograms total for the day. That is injected under the skin, and actually the injectable form is better for injury recovery and post-operative recovery from surgery. Post-op protocols may be 2 to 4 weeks in length. Well, if we're trying to heal the intestinal lining, those may last 3 to 6 months in length. And remember, anything injectable needs to come from a sterile compounding pharmacy. What results have I seen in my clinical practice from BPC 157? My post-operative patients report healing quicker as compared to prior surgeries, even after the age of 65. GI patients are tapering off their acid blockers after having their symptoms resolve, and that stomach healing their esophagus heals. My autoimmune disease patients have noted reversal of their disease process, and one Graves' disease sufferer had normalization of her thyroid function in 6 short months. I've had 3 patients with EOE or eosinophilic esophagitis recover their symptoms fully, 2 of which were documented by repeat endoscopy. Now, dosing may vary and you need to work with a provider. What are the side effects of BPC 157? Now, I'm glad you asked. Generally, it's so well tolerated. Some patients will report mild site injection reaction if you use injectable, or slight nausea or a little fatigue in that first week. Of course, I don't recommend it for anyone who's pregnant or breastfeeding, or with anyone with active cancer, or anyone with a bleeding disorder. And again, this should not be for self-experimentation. I always say medical supervision is non-negotiable. BPC isn't a miracle cure, but when used wisely and appropriately, it can be a powerful tool in regenerative healing. If you're curious whether it's right for you, work with a provider experienced in peptide protocols. In an upcoming video, I'll be covering TB500, the other half of the Wolverine stack. So hit subscribe, tap the bell, and leave your questions below. I read everyone. We're entering an age where science meets regeneration and knowledge is your best superpower. This video is for educational purposes only and does not constitute medical advice. BPC 157 is not FDA approved to diagnose, treat, cure, or prevent any disease. All examples reflect individual experiences and are not guarantees of outcome. Injectable peptides must be sourced from licensed sterile compounding pharmacies and used under qualified medical supervisions. And individual results may vary. Until next time, I'm signing off.